All right. Well, we'll go ahead and get started because we have a lot to share and a lot to talk about. And Erica, I want to thank you for taking time and joining me to talk about something that I know both of us are very passionate about. Today we're going to just kind of go through it. We'll have a lot of good banter. We invite everyone to one, maximize the deck by double clicking on it. It'll make it a little bit bigger on your screen if you'd like. And then also, if you'd like to interact with us, feel free to do so in the chat, or we'll try to monitor that while we're presenting and invite you to participate. So without any further ado, we'll see if I can wrangle this PowerPoint, and maybe not. There we go. All right. So just a quick introduction of myself. I'm a director in our Infor Services practice. I lead our West Coast office. I have lots of experience in healthcare, both being in your shoes and kind of sitting in the IT director position at several facilities, Dignity Health, Phoenix Children's, Cancer Treatment Centers of America. So I understand your pain from that perspective, and then I flip back over to the consulting side where I try to solve your pain, especially leveraging some cool technology from Infor. So that's a little bit about me. And Erica?
You left out the fun stuff, Michael.
I did, yeah. I'll go back and just
I wanted to hear about the
Yeah, I'm also a DJ and a party bike captain in the city of Scottsdale. So if you're up for a drink fest, I'm your guy.
Thanks. So thank you so much, Michael, for having me here today. So I actually joined Infor about 4 years ago as a human capital management strategy director. I specifically work in our healthcare vertical because Infor has a bunch of different industry verticals. Prior to joining Infor, I actually spent pretty much my whole career, about 20 years in the healthcare space as an HR practitioner. So in my role today, I get to do awesome things like this. I get to engage with our customers and our product teams to think about, the future of human capital management and how we can elevate our roles in HR. And I also co-chair. So Infor has a bunch of employee networks, and I co-chair our Women's Infor network for the Americas. So that's a new role that I've taken, and I love it. Yeah, and that's where we focus on advancing women in leadership roles. And then just on the personal note, my fun is not as much fun as yours. I don't drive party bikes, but I live in Syracuse, New York. I'm super excited. We were coming off our coldest May, and it's sunny out, so I'm going to definitely take a walk this afternoon. I have two 13-year-old boys that keep me super, super busy. I actually sent them out to the golf course this afternoon, so it would be quiet for this. And speaking of golf, I try really hard to do that, but I'm not quite good. But I call that one of my hobbies. And I do some volunteer work, and probably one of my favorite things to do that I really miss right now is a book club with my friends. And I probably miss the part where we just socialize and have some wine together. Thanks for having me.
Yeah, awesome. Thank you for taking the time, Erica. Appreciate it. One other quick administrative note. We are giving away a unicorn. These are little plushy unicorns. So Twilight is the first RPI unicorn. So if you're interested, all you have to do is just caption that photo of Twilight that's there. Just send me a caption to mgrace@rpic.com. Or Dorcas is actually moderating the room, and she'll capture it. You can put it in the chat. It's our first one. So if you want the beginning of the series of unicorns, this is your way to get it. So feel free to do that. All right, here we go.
Thanks. So I thought I would kick it off today. I wanted to set the stage, Michael, just to kind of talk about healthcare and the state of healthcare right now before we dive deep into managing and retaining talent in healthcare. But I want to focus more on the silver lining and the positive things. I feel like there's enough of that to go around, and it really does tie nicely into the topic that we're talking about today. First of all, anyone that's on the line today or listening in that's in healthcare, I thank you so much. If you're even if you're not in the front lines, right, your contribution is, unimaginable in a lot of ways. So I certainly wanted to take a moment to say thank you. But we're all familiar with the fact that we're going through tremendous change. And I listened to this podcast, and Michael and I have some sources listed in the appendix of the presentation, but I listened to this podcast, Fireside Chat by Gary Bisbee, and it's awesome. If you don't listen to it, I highly recommend it. But I want to share a quote with you. So Dennis Murphy, so he's the CEO of IU Health, and he was on Gary's podcast, and one of the things he talked about, he was asked by Gary about the new normal, and Dennis, quickly said, well, it's not the new normal. We're calling it the next normal. And he said, we've been talking about this idea of a series of the next normal, which is we're going to monitor data, continue to adjust and adapt as an organization. And we've avoided the new normal because it almost feels like a destination, and then you become static. And I really liked that. That couldn't be more accurate when we think about healthcare. So, I think we'll really focus on the next normal as we go through this. So a couple of other, just so from a silver lining standpoint, a couple of things that are happening is, we are reassigning or redistributing our workforce or redeploying our workforce. And, clearly there's financial challenges, which we're not going to dwell on today. But, there's bad things happening with furloughs and layoffs and things like that. But there's also this opportunity when you think about talent mobility and people moving into different positions in the organizations. Physical therapists making masks and greeting people. And, at Cox Health, they have somebody who works in their gym who's actually now taking temperatures and working closely with the families of patients because those two can't see each other and interact sometimes. And, some administrative employees being redeployed to call centers. And one of the things that I'm hearing is, some of these employees are like, wow, I've never felt such a sense of purpose. And then you've got this whole remote workforce, which was actually, if anybody follows Josh Burson, he had an article on LinkedIn today, is working from home, the new fad. But some people love it and some people don't like it, right? But I do see, as we think about the next normal, more of that. And one of these podcasts I was listening to, Joanne Conroy, who's the president and CEO of Dartmouth Hitchcock Health System. And they quickly redeployed 4,000 employees to work from home. And she did a quick analysis and worked with the IT department to say, how many people worked from home before this? And it was a handful. And she loves it. She wants her leaders to embrace it, fully acknowledging, though, the leaders are going to need to train to develop and lead a remote workforce. But the statistics say that those folks are going to be more engaged, and 50% less will leave an organization, which is huge. And then there's the role of the CHRO, which is near and dear to my heart with my HR background. But, HR in general has been thrusted into the limelight. They're very visible in the spotlight. I was reading a LinkedIn post. This woman was walking down the road and her neighbor came out and said, thank you for what you do. And she's like, oh, well, you're welcome. Well, the neighbor was thanking her because she's an HR employee. And she said it wasn't until this crisis happened that she really realized the role of HR. And clearly there's other things. If we think about the future of healthcare and physicians, we have a shift to telemedicine now. There's probably going to be more of that in the next normal. Different types of positions, virtual care coordinators and positions like that. And the good news is, healthcare job growth is still going to happen. There was a study that I read by 2028, 12% is just RNs alone in terms of the job growth. And I'll leave it on this final little silver lining, which is not healthcare specific. We're seeing this in a lot of industries, is communication. People now are hearing from the leaders in their organizations much more frequently. And not just hearing from them more frequently, but the communications have been very transparent. So there's my little opening. Michael, I'll let you dig into the agenda there.
No, I love it. I love it, right? Because we hear so much, not negative, right? But it may appear negative, right? We hear all the struggles and such because those tend to be newsworthy. So it's awesome to kind of look for those silver linings and all of that because they're for sure out there. So We'll talk a little bit about the current crisis. We'll talk about some tools for the future, right, to help you kind of think about the next normal, and then some of the benefits that can come out of this, because there are some, right. So the current crisis is upon us, whether we want it or not, and it's, both from a healthcare perspective, it's the tactical in the facilities, but it's also from our perspective, right? It's also a labor challenge affecting all of our employees, and not just our clinicians, right? It's affecting dietary, it's affecting housekeeping and such. Everybody is in this new world, even your administrative staff that might be working remotely at home. So we'll try to cover as much of it as we can in the 48 minutes that we have. And I always say, right, feel free to reach out to either Erica or myself. We'll have our emails at the end. We'd love to continue the conversation, or if you have questions, we're happy to share. So.
Yeah, so Michael and I just wanted to talk a little bit. Can you continue the discussion a little bit of the landscape? But we're going to kind of bring this into, the recruiting and bringing people into your organizations, and then the retention. So, this is really interesting. So this study was done in April of 2019. The United States will see a shortage of up to nearly 122,000 positions by 2032 as demand for physicians continues to grow faster than supply. And I have to wonder, Michael, and I think about this, what is the mindset of those folks in medical school right now, or people that are making the decision if they want to go into medical school? And how does this impact their thinking? Certainly there's the side of physicians being burnt out, and there's these new healthcare models like telemedicine, and and then the impact of compensation on some physicians and the way that they were compensated and how this has impacted them. So it'll be interesting to see how many more people move into the profession. But I have to believe that this is a profession, it's more of a calling. And folks may actually, more people may go that way. And there's some social media sites out there that have asked medical students and those approaching medical school to kind of weigh in, and the opinions are a little bit mixed, but overall, more people are saying they want to join because of the pandemic, and a lot of it too to be advocates for just changing the system in general.
Yeah, in addition to our physicians, our nurses, we've long heard, right? We've heard more recently, I think, around our physicians in terms of burnout. I don't know that we always hear about the nursing shortages, but obviously there's a provider shortage as well. The nursing shortage is getting worse, not better. The World Health Organization stated that there is a global shortage of 5.9 million nurses in 2018. And it becomes really apparent when you look at it more on the world stage than perhaps in just the United States. So the Americas are going to see an increase of 43% of nurses, but that's still falling short of the demand. And we'll talk a little bit further. We'll go into the demand exceeding the supply, right? And it's such a bigger issue, right? There's a shortage of educators in nursing schools to even educate nurses. If you know any nursing students or any nurses, you will find out that they had a wait list, right? So here they are, they want to help the problem. They want to come into the industry. They want to serve. They want to take the oath. They want to help people, and then they're told there's no room at the inn. You can't enter nursing school. You need to now go on a wait list for 2 years because we don't have enough nursing educators, right? So we have all these kind of barriers to the issue. If you look at the areas of lower income, right, they're seeing far less growth of nurses, right? Nurses aren't serving in third world countries as readily as they are perhaps in developed economies. So that creates, again, a world stage problem Even though the workforce is expanding, it's just not able to outpace the need in the nursing arena. And it's geographical. You know, if you look at where the biggest shortages are, well, that's where the most people live. They live on the coast with beautiful weather and water to go play in. But that's also, you know, where we're seeing the largest nursing shortages. So, you know, geographically, no one's really immune, except perhaps if you're, you know, in the Midwest, you might be okay right now. And it's also by specialty. So it's not like, oh, ICU nurses are short, but everyone else is okay. If you really look across all of the nursing modalities, they're all experiencing a critical shortage, and that's projected to just get worse. So when you're a facility or you're an operational leader in an acute care, how do you get your nurses? How do you get the right nurses? How do you get them plugged into the right career field so that they want to stay and grow and have a great career with your organization? Those are some things that Erica and I are going to try to help with.
Yeah. So that kind of ties into, so why are people leaving? Challenges at work, as Michael and I called it. So, you know, why are employees leaving healthcare? And some of these aren't, you know, some of these are very specific to healthcare and the types of roles you're in healthcare. And some of these are pretty specific to a lot of industries. They cover a lot of industries. So, you know, first of all, when we think about turnover, you know, it does have a significant impact on patient satisfaction and treatment outcomes. But also it costs a lot of money. Here's just a statistic here, you know, 5.2 to 8.1 million annually. Michael, I know you're going to touch on this in a minute when it comes to RNs specifically, but, you know, if we look at the reasons they're leaving healthcare, well, burnout, you know, even before this outbreak, there's some stats out there that say 63% of hospital nurses experience, you know, and reported burnout, okay, caused by long periods of stress. Now, throw this in, if you're in the front lines, hotspot or not a hotspot, right? You are treating patients with COVID. You're working long hours. You're trying to avoid the illness yourself. Maybe you're isolating yourself from your family. Then there's staffing and workload, which has a nice tie into burnout. The heavy workload of hospital nurses is a major problem across our entire, you know, healthcare system. And, you know, nurses are experiencing higher workloads than they ever have. And then there's this increased demand for nurses because we've got this aging population with an adequate supply of nurses. Career opportunities, this is one that can definitely, you know, go across many different industries. And you hear this a lot is, you know, employees want a sense of working towards something. And, you know, this is, you know, there's an interesting poll I read. So a bunch of, you know, this poll was done with employees who left a particular organization because of career opportunities. And they polled those same organizations where those employees left, and they said, well, we offer development opportunities and career opportunities. That's all there. So there's clearly a disconnect. And then the frustration of being an employee that maybe you've been passed up for a promotion. And sometimes you don't want to advance maybe up. Maybe you're good at what you do, but you want to advance your skills and expand your skill set. And sometimes people don't feel like they can do that. Then, of course, there's the immediate supervisor. We've all heard the phrase, you know, we leave our bosses, not our companies, but, you know, they quit the company and the boss is part of their responsibility, right? And, you know, for a variety of reasons, maybe the boss isn't communicating well, or they're micromanaging, or they're taking credit, or, you know, they're just not listening to their employees. And then, of course, comp and benefits, you know, people do leave for pay. It's not always number one on the list, but it's important to all of us. And I think the benefits landscape is definitely going to change. Now we'll talk a little bit about that later. And then, of course, you know, from an hours and scheduling standpoint, you know, working longer hours than you're expected. And, you know, you can't just end a shift sometimes, right? It's just not easy to walk away. So, and that kind of ties into that staffing and workload as well.
The nursing turnover costs are real, and if you don't think they are, please reach out and I'll help you understand it. It's in your data. I'm kind of brutally honest with this topic because we've got to fix it, right? We've got to find a way to solve the problem, and all be thought leaders here, and we can't pretend like it doesn't exist. The last facility that I was at, we had two trends that we saw when we really did a lot of data analytics. And I'm not talking like, oh, we ran a report and suddenly we understood this. I mean, we really dove into it. We found two alarming statistics. One was every time a nurse left our facility, the cost was $59,048, right? That's recruitment costs of a new nurse, onboarding of a new nurse, separation costs, right? The disruption in service. It was $59,000 every time somebody left. We had 20,000 nurses in our employee, and turnover was at an alarming percentage. The other interesting statistic we found when looking at the data was 1 out of every 3 new nurses left in the first 90 days, right? Why is that alarming? That's alarming because we attracted them, right? So it wasn't comp, it wasn't benefits. They came. So, right, can't say it was money or such. They actually came and they started in our employ, and then they left, right? Why? Because they weren't plugged in, they didn't feel part of the culture, they weren't delivered on what was promised. And we'll talk about some of those problems, but when you start looking at the actual cost and you go, well, I don't have money for some of these programs you and Erica are going to talk about, or investment in technology and tools, you really do. Because if you can take those tools and you can affect that turnover percentage in just nursing, forget about how those tools are going to help all your other positions, but just nursing, if you can reduce that turnover down even 2, 3, 5, 10%, at $59,000 a person leaving, and nurses are the largest part of the workforce in an acute care facility, that becomes tens of millions of dollars very, very quickly. So I challenge you that the money's there. It's just rethinking how you're acting.
Yeah, and one thing I just want to comment, because Eric's putting some great comments here in the chat box, and we talked about this at the beginning with layoffs and furloughs in organizations. The reason being with the elective surgeries going away, and now they're starting to come back, and you have to wonder, is there going to be another surge? I'm not talking about the COVID-19 potential first surge, depending on where you live, or the second potential surge. If the people who've been putting off their medical care because they don't want to walk into the office or they don't want to go to the hospital, and there's been all this information out there about that. So you have to wonder what kind of surges we're going to have in healthcare. And then secondarily, when we talk about the shortages and the types of positions, there's critical positions that have come out of this, with ICU and med surge and respiratory therapists. And so it'll be interesting to see the types of positions, because I can see more of that critical care type position being, harder to fill in the future.
And many of you might not know, but my wife is a nurse. She's an ICU nurse. She's currently a coordinator of a lung transplant program at a major hospital here in Phoenix. So that means a lot of our friends are nurses. And here I sit, on the leadership side, currently, in software consulting. But I often, when we go out with all these nurses, I just ask them, what is it about it that you like, you don't like, and I try to figure this out. And honestly, they say, hey, you want to pay the same for nurses across the board, right? Why would I want to get additional skills? Why would I want to be an ICU nurse or an ECMO nurse and get all that training and, be in a higher risk position and, risk losing my license and such with improper patient loads. And, so then they move out of nursing, right? They don't, it's not that they don't want to help the patients. That oath is still very much there. That driver is still very much there. We just are incorrectly incenting them to do what we want them to do, right? Which is to get additional skills, to become better qualified, to feel part of the solution. And some of you might say, well, magnet hospitals are kind of, well, magnet is a method of kind of involving nurses in decision making. At the tactical nurse level, I can tell you that that alone doesn't make the difference. You know, the feedback that I get, very real and honest and raw feedback, not scientific in any sense, is you know, that the ladder system is wrong. Pay for performance needs to move its way into nursing, and this is not something that you can just do at your hospital, especially if you have represented labor. That becomes an even bigger challenge. And you'll notice my talk track on this is A, passionate, and B, unfiltered. I'm strongly opinionated on the problem because it's got to fix itself here, or we're just going to be in a bad spot. So I love this quote by Aristotle, right? Again, our nurses that enter the position, they want to be a nurse. And at the core, they want to help people, and they want to work for a great company, and they want to serve. That is their driver. Their driver isn't, oh, I want to go make more money. You know, those tangible things aren't necessarily what is driving our nurses. What happens is our nurses get into a facility, and, you know, as a hiring manager, we just need nurses, right? I've got, you know, 50 open nursing positions, and here comes Erica. Well, I'm going to plug Erica into one of those because she's an RN and I got positions to fill. And, you know, then what happens is, you know, Erica's in the wrong position, and Erica's not onboarded correctly. And Erica is not, you know, maybe we put her in the ED and she would have been a way better ICU nurse, but we didn't know that. And we didn't take time to really understand, you know, what skills and what drove Erica from a science perspective. So we just kind of plugged her in a position, and well, she's miserable. So she hangs out for a little while because she needs a job. And meanwhile, she's looking for another job. And then she says, well, maybe I want to go to the ICU. And your position at your company, your policy says, well, no, we're not going to let people transfer because you're within your first 90 days. Oh, okay. So then Erica says, okay, let me solve that problem for myself. I'm going to go over here across the street and I'm going to work there, and they're going to hire me on as an ICU nurse. So now you lost somebody who was motivated by the profession, wanted to be a great employee, and you had policies and lack of science to help you put her in the right position. So she left. Now you incurred $59,048 for Erica, and you can go start that process all over again. So I challenge you to break that process and think differently. We'll talk a little bit about how we can help, right? Some guides for the future. And this is an industry thing, right? This is not a facility or a manager doing it. It's a little bit of tool, it's a little bit of process, it's a little bit of different thinking, it's a little bit of culture change.
Yeah, so these are just, you know, some of the opportunities that we have to address the challenges that we outlined. We're gonna touch on all of these, but, you know, this is what we're gonna focus on. You know, the hiring and the onboarding, predictive analytics, and artificial intelligence. How can you use predictive analytics in the hiring process? How can you use it throughout the employee's life cycle? Workplace safety, which is more important probably now than ever. Scheduling, flexibility. We'll touch again on that topic of remote work. And of course, we'll tie it all back to compensation and benefits. And then we'll talk about this notion of continuous performance engagement and continuous learning and development, those ongoing feedback discussions and the ongoing learning.
Awesome.
Yeah, so I want to tie it back to technology here a little bit. And actually, I want to kind of kick this off with two things. I'll talk about technology, and I also want to talk about recruitment, because that's where all of this starts. From a recruitment standpoint, who you're bringing into the organization. When you think about retention, you really have to think about that first. And then when we think about technology, we have to consider, you know, the everyday employee experience. And how can we leverage technology through these challenges? Now, you know, technology isn't going to be the answer for everything, but it can help enable and be part of the employee experience. Now, in this perfect world, you would have one solution or not as many solutions, not 25 different third-party solutions. Because if you think about the experience of your employees, you don't want them to have to go here to, request their time off, and here to view their paycheck, and over here to, take their learning courses, and over here to see what their goals are, right? You really, in a perfect world, you can bring those things together, because that'll have a big impact on your employee experience. And I also don't, I'll close here, I don't want to stereotype on generations, but I definitely think there are some differences with generations. And I also think there's a lot of similarities, which if you look at these younger generations, Generation Z, they're like in their early 20s right now, all they think about is technology. And their technology role has been so different than ours. And they have an expectation when they join an organization that it's going to be very sophisticated technology, because they might not want to work there if it's not.
Love it.
Yeah, so let's talk about recruitment. So this is where it all begins, right? And I think we really need to start to think a little bit different about how we attract and hire people. I've done a lot of recruiting in my life, and I think it's come a long way, but there's still so many opportunities. There's a lot of cool companies out there, some pretty neat niche players out there that will really help in this. And then, of course, you have your enterprise solutions too that will help with this. But what are some of the things that you could be doing with technology? Just if you think about the general process, typically we post a position and hope that somebody applies for that position, and then we hope to find someone to fill that position. But how can you reach broader talent channels? So when you're thinking about recruiting, how can you get to emails and leverage email more effectively, leverage text messaging more effectively, social posts, internal communications, all of that. Kind of think of that candidate relationship management. And then starting with the hiring right before you address retention, thinking about things other than qualifications. So we focus a lot on more of those tangible things in the recruiting process. How many years of experience do they have? What's their education, their credential, their licenses, all of that. That stuff is really, really important. But then what about all the behavioral characteristics for each of our positions? And I was reading this article about physicians going through med school now, and with COVID-19, there's more of an emphasis on empathy and how to use empathy in their role as a medical provider. And that would be a behavioral characteristic. So what we do at Infor is we have this, and some of you may have heard this, it's called talent science, and it's a differentiator for us, but it's where we leverage predictive analytics. And we leverage call it the behavioral DNA of a candidate coming into the organization. We do that. They take a 10-minute assessment, and then our industrial organizational psychologist that works with our customer helps to build a behavioral profile for those positions, because each of the positions are a little bit different. A nurse in the emergency department is maybe going to have different characteristics than a nurse that's in an operating room, because the patient's asleep versus the patient may not be asleep. So how do you get insights to make sure you're hiring the right people for the right job, which can ultimately reduce your turnover? And then how can you manage candidates through the various phases? When we talk about communication before, this is so important. Whatever your process is, to look at the various stages of they've applied for the job, how do you communicate with them? They're going through the screening process, how do you communicate with them? So on and so forth. This is going to be their first experience with your organization, their first exposure to your culture. So those are just a few things on recruitment. And we can advance here to the different challenges. So why are people leaving the organization? So, Michael, I don't know if you want to start it off and just share some of your perspective on burnout.
Yeah, absolutely. I mean, we talked a lot offline in prep for this session around, both physicians and nurses are experiencing burnout. It's a high stress job. It's modeled on a 12-hour day typically, or longer. I think it's scheduled for 12 and often exceeds that. Right. So just the hours on your feet, just the engagement and the intensity of that engagement is both mentally and physically exhausting. So when we look at it, and we did a bunch of statistical studies and read through a whole bunch of information to really look at how do we affect that, right? Like, oftentimes a nurse manager might have 20, 30, 50. I've seen 120 nurses to one nurse manager. Between leader and employee is very low. Typically only around that annual review process, right, where they're forced to. And they don't really know that nurse, so there might be some peer evaluations. But that's really kind of the only kind of interaction that the corporate leadership is getting with that nurse, right? And what about if we change that, right? What if nurses use with them far more frequently with a tool like a pulse survey? Perhaps we just ask them, and the challenge here is don't just ask them work things, right? Don't just ask them, if you ever punched out on a time clock, did you get your 30-minute meal period? Yes, no. Right, that becomes very automaton in their answer. They just click through it. But ask them things, how are you feeling today, and how was your last shift? Or did you do something fun this weekend? And let them reply back, right? The more you move from a once a year interaction or a twice a year interaction, and you move to a once a week, twice a week, right? Interaction, it becomes conversative in nature. That those types of pulse surveys and interaction make you part of their daily interactions, right? Like they're chatting with their friends or they're texting their kids. That bond mentally moves them into a different category, in like that friend category. And it's a little easier to leave your friends, or a little harder, I'm sorry, to leave your friends than it is to leave an employer who only talks to you once a year. Getting kind of predictive around the flight risk. So understanding what drives people to leave, right? Understand who your top performers are, understand what the triggers are, and then look for those types of things through data that might be happening to other people in your organization, so that you can become preemptive rather than reactive. And then location-based intelligence is absolutely key. Most hospitals have some sort of this where, nurses, if they feel unsafe for any reason, and those are in areas that you might not suspect, right? Maybe the nurse is walking to the cafeteria and an upset family member creates a situation. You need some way for that staff member, that nurse, to get some help, right? You need an emergency call button that is accessible to them, not on a wall 60 feet away that they can't get to, that tells security exactly where that person is so that they can respond. Sadly, and even more so sadly in this pandemic, the violence in that healthcare setting with those nurses is on the increase. So location-based intelligence becomes important. And Erica, I know Infor has some tools around all of these.
Yep, absolutely. And I would also just say on those flight risk predictive analytics, we have so much data on our employees. Imagine just looking at things like, hey, this person hasn't taken a day off in X amount of days. They've been working, overtime for however long, and how much overtime, and how many days in a row. There's just so much data there that you can pull together to determine, is somebody at a flight risk? So I think analytics it's huge, and it's becoming more and more, powerful.
Absolutely.
Yeah, and just to advance forward on staffing and workload, this is really where that workforce management comes into play. Being so much more than a timekeeping system. This is probably the single most pressing, frustrating thing for clinical staff. scheduling imbalances, improper staffing, workload, unfair workload. There's some organizations that we talk to that are still using a paper-based scheduling process. So, with your workforce management solution, you really want to be able to have some scheduling requirements and projecting in place, 6 weeks in the future. Of course, you have to balance that, right, on your patient census and your budget, and all that stuff is constantly changing. But that's, where you can also have like a data exchange with, all of your different systems, including your Epics and your Cerners and so on. And then, also when you think about nurse burnout, when it comes to flexibility, giving them more power into their hands, and I'm holding my phone if you can see me, but giving them more control, the ability, this is something new that we have just done, but having a shift billboard where you can take shifts or you can swap shifts and you can do everything on your phone, but giving them a little bit, empowering your caregivers a little bit more, and giving them a little bit more balance in their life. So I'll turn it over to you for career opportunities, Michael.
Awesome. Right, I always say you got to allow them to move within your organization, and you got to make it so easy that it's easier to move within your organization than it is to move outside. And oftentimes we have policies in place that prevent this, or we want to understand why, and we get all hung up on that. And while we're trying to do that, they just leave. Make that accessible and educational, right? Help them understand, what is it like to work in the ICU? You're asking them, you have a need there, you make more revenue there, so why would you not want that to be appropriately staffed, right? So tell them what it's like to work there, day in the life of an ICU nurse type of thing. Share that. Have a passion for diversity, obviously, so they feel welcome and included, and then incent them to learn new skills. And this is Michael's rant on the whole ladder thing, which I just don't think we're rewarding tenure versus somebody who's fired up to learn ECMO and ICU. So let's make sure that we incent them with some sort of shift differential for learning additional skills, much like we do when nurses proctor. They typically get an additional fee there. The internal career fairs is a great idea, where much like going to a career fair where there's all kinds of employers, have a career fair where folks can come and learn about different areas and what's it like to work there, and then let them go there, because if you don't, they're just going to go to your competitor and they're going to work there. So you want to retain the great talent, reduce the manager ratios. We shared earlier about some of the crazy ratios. Or have other ways to interact with nurses, right? And a huddle isn't the way to try to care about a nurse's career, right? A huddle is a great way to disseminate information to large groups of nurses starting a shift. It's not a great way to say, Nurse Erica, I really care about you, in a huddle, right? That's not communicating with her or taking an interest in her career. And that could be online tools, right? Leveraging some an indication that Nurse Erica is interested in doing something a little bit different or learning something else. You want to capture that, and then obviously giving them those opportunities for continuous learning and development. I think then we'll talk a little bit about leadership and support and development.
Yep. This certainly ties into it, because having those continuous development discussions with your employees is so important. But when you think about, I'm leaving because of my immediate supervisor. And as an organization, we have to think, well, how do we support our leaders? How do we develop our leaders? Bad leaders force good people to leave. And there's a couple of things here that Michael and I talked about, is just, from a performance management standpoint, having 360s or some way in which different groups, peers, subordinates, leaders can evaluate your leaders. And again, when I was talking before about all the data that we have our employees, you can take all of the data that you have, be it the 360 data, the pulse survey data. There's a lot of data that you can pull together to really understand where you might have some gaps, maybe the turnover data for certain supervisors. So you can start to identify who do we need to support. And then also, we talked about some of this other stuff today in terms of, development and, talent science and making sure that you're hiring somebody that has those behavioral characteristics to be a leader. But another thing I was thinking about to help leaders is understanding their team. There's lots of different opportunities in the marketplace to learn more about your teams. At Infor, we just created this. We have a new solution called Team Dynamics. But it's where you take that talent science assessment essentially, and an industrial organizational psychologist will bring all that information together, and it's a great team building exercise. But you can bring it all together and help your leaders understand the different characteristics of their team and how their team fits together and works together. So that can be really powerful because everybody is so unique and so different. So
everybody wants to work on a great team, right?
Yeah.
Not only your individual self, but being part of a great team, you're just like, oh, this is great. And you look forward to going to work.
Yeah. So on rewards and recognition, I didn't call this benefits and compensation. That was the challenge. But I wrapped this more around rewards and recognition. But, and I'll explain why here in a second. But, knowing your market, knowing your people is really important. And this is where I think the CHRO's job is really tough because, and I'm going to bring, maybe I shouldn't even bring my generation thing. I'll just talk about myself here. I know from a benefit perspective, my boys are going to be 14 next month, but I can tell you when they were toddlers, we the daycare was not cheap. To have them in daycare at the same time. And I'm sure probably most of our listeners have been through that. But now for me, what I'm starting to think about is more of, okay, college savings and then going to college. So I think different people are at different phases in their life or have different interests or whatever it may be. So being able to have benefit programs that, almost like a cafeteria style plan where you can choose different things that fit your needs, so you can really personalize that experience. Or think about those, ancillary benefits that you can offer to a wide range of employees. And then also recognitions, I think is so important, and we really haven't talked about recognition yet. And that ties into a lot of reasons people are leaving. And I'll just share something that we do at Infor. We take recognition and we bring a little gamification into it. So we have something in our solution called Raves, and and different organizations have different ways to recognize people as well. But when somebody gets recognized, after you reach so many Raves, you get a badge, and then you continue. You get a few more, you get another badge. You get a few more, you get another badge. I actually don't get anything every time I get those badges beyond, I got the badge. And it's amazing, just that feeling, that's tied to that. Of course, you could tie points or monetary stuff to it as well, but just that feeling. So I know I think you touched on these last two, Michael, regarding the ladders and the pay for performance. I don't want to add anything else there.
It's funny about the badges, right? I wrote an article about you want to hire gamers. And I jokingly said, I only hire gamers, right? Because I know what incents them. And it's badges, right? And I can give badges all day long, right? But it's a different type of motivation, and there's pride, right? Those are the employees you want, the employees that want to accumulate badges and such. It didn't cost you anything. But they're very engaged in that program. So yeah, and the last two I think we definitely touched on. Hours and schedule. Erica, you touched on this. Allowing them the freedom, and this is a hard word for people in healthcare. Trust your employees. right? If they're really bought into your mission and what you're trying to do at your facility, and you're honest and you're transparent, I jokingly say there is no reason for unions, right? Unions are a failure of the employees and the employer to come together in united mission. And I know I speak boldly on that, and people might react to it, but honestly, be flexible, trust your employees, share your problem with them, what you're trying to do, and let them amaze you with their ability to contribute, but have a tool in place that makes that process very, very easy for them. And allow your folks to work, remotely. And if you're thinking you're going to bring, all these folks that are now working remote, and somehow you're going to say, okay, the pandemic's past us and now you all need to come back, be prepared for some pretty heavy resistance there. People are enjoying working at home. I think, Marcus and I just gave a session on the main stage about the future of work. And I think, you need to be prepared for the fact that those folks aren't going to want to come back. And if you make that a condition of employment, they very well that might be what forces them to go somewhere else. So just be aware and consider that. I love this slide to really wrap it up, right? We just need to rethink it and use different tools and try to make work easier for our healthcare professionals on the front lines, right? We need to rethink things like 12-hour shifts. Do you really want, if you're in your most critical moment, do you really want that doctor or nurse that's on their 12th hour of the 12-hour shift, or 15 hours because they had to stay late, and they've been standing all day and they're burned out and they're tired and they're exhausted? So just be careful, and take the challenge to rethink some of the things that come out, because there's lots of benefits, and Erica's going to share some of those.
Yeah, I know we're getting close to the top of the hour, so we'll conclude on the section of benefits here. But I try to break this down into a couple of different buckets. I broke it down into kind of the financial, the cost, the engagement, and then it all does tie back to the patient at the end of the day in healthcare. But there's this quote that I read, and it says, because engaged employees are typically they're thorough, they're responsive, they produce higher all HCAP scores. They rank typically in the top 25% of employee engagement, and they also score in the top 19% of the highest ranking hospitals with HCAP scores. So I love that stat, because from a financial standpoint here, you have the ability to, reduce costs, less advertising, fewer vacancies, fewer new hires for onboarding and all the associated training costs. From an engagement standpoint, the more engaged your employees are. I mean, I know some of this is, common sense, but you're preserving that institutional knowledge that may have walked out the door. You're increasing productivity. It's an overall better work environment, and of course, from a quality of care standpoint, right, where you're decreasing your patient errors and increasing the quality of care. And then, where could you spend money? When you think about the return there, at least from the financial standpoint, you're not spending so much money in your turnover cost. You have the opportunity to spend more time on, and I won't read all of these, but hopefully developing some more programs, investing in some technology to accomplish some of the things that we talked about. Not everything is that we talked about today when it comes to the technology. There's cost associated with that, but to give you that technology to support, to help you achieve your strategic initiatives. And then from a compensation and benefits standpoint, maybe you can move the needle a little bit on compensation. Maybe you can bring in different benefits that traditionally you weren't able to leverage in the past. And again, we talked about that landscape changing, and even just like the mental health benefits during this crisis for everyone, and the financial benefits. So hopefully you'll be able to spend your money in different ways. And on a culture shift, I think culture, this is really interesting. And I know we've hit on most of these today, but I just, when I think of culture, when I think about my former HR role, and I would be interviewing a candidate, I would get the question, so tell me about your company culture. And I used to sit there and I was like, gosh, how is everyone else answering this question? Is it different? Is everyone answering it different? Well, that could be a problem. So I don't know. That popped into my head, but I really think culture is being reshaped right now. The pandemic is going to have lasting effects on corporate cultures. Things are happening now where we're seeing more leaders starting to listen more to their employees' concerns, which likely may be their own concerns. And it's an opportunity, we're using this as an opportunity to build better relationships with the people that we work with. So it's going to be interesting to see how culture shifts with this pandemic. Awesome. And just one other, on the jobs and purpose, I mean, there's no better place to be than in healthcare, right? We have a leg up in this industry when it comes to seeking meaning and purpose in your role. So I'll let you wrap up here, Michael.
Awesome. Yeah, and I just wanted to mention, right, for just some moral guidance, right, a great book by Paul Spiegelman called "Patients Come Second," right, which there's so much focus on healthcare, on the patient and the procedure, and all the regulations and such. Again, back to trust, right? If you empower your employees and really focus on them, they will serve your patients. They want to do it. It's why they entered healthcare. You just have to kind of change that paradigm shift back to culture. Paul leaves us with 9 ways to help a culture of employee engagement. This deck will go out to all the participants. So, they're intrinsic things, right? They're the mission, vision, and values. Have fun with your employee culture. Make it a great place to work. Prioritize their well-being. Connect to them honestly and transparently. Employees that don't fit your culture, I have a book called The Energy Bus. Get them off of your bus one way or another, right? Because that is poison. Allow ongoing dialogue between leaderships and the staff. We talked about pulse surveys and ways to make that very easy. Erica did a great job of talking about rewards and recognitions. So without using this as our barometer, right, for an hour, most of the 9 ways, which we believe can be a paradigm shift in helping you retain talent. We are always happy to chat with you more in this track, in the healthcare track. We're going to now talk a little bit about COVID and some strategies for emerging from that. You can always catch me at TechProUnicorn. Erica, I really want to thank you. I'm going to put up our email addresses for taking the time, talking about a topic that I know both of us are very passionate about. And luckily, Infor has some tools to help customers. So to talk product, Erica is probably your great point of contact. She can point you places. We do have some sources as well that are available, things that we may have referenced, and great ways to learn more about the product and the problem. And again, reach out to Erica or I, and we're happy to be your galaxy guide through the galaxy, or your hitchhiker's guide through the galaxy to figuring out how to solve this problem.